Hello, and welcome to Women's Health. This is a series about women's health that is sponsored by the Mayor's Commission on Women and in conjunction with 10 Health. Today, our topic is skin cancer. My name is Kathie Urhmacher. I currently serve as chair of the Mayor's Commission on Women. And my guest today is an expert in this field, and Lott. So Dr. Lott is here to talk with us about skin cancer. So Dr. Lott, let's start out with, what are the different types of skin cancer?
You didn't tell them that I'm on the commission and you made me do this.
That's true.
Yes.
Dr. Lott is on the Women's Commission, and
right.
she's kind of been
encouraged
to help us today.
Yeah.
So, and thank you for that.
Thank you.
Okay, so what are the different types of skin cancer?
It's important to talk about skin cancer because it's the #1 cancer statistically. And I think that we forget because we don't want to accept the fact that 1 out of 5 of us will have a skin cancer in America.
Wow,
so
that's a staggering statistic.
It is, and it's not, a good bit of news. I went to the Skin Cancer Foundation to get the latest statistics, and I have to admit, I was pretty overwhelmed. With the exception of melanoma, which is our biggest concern, because we didn't go into dermatology to lose patients.
No.
And this is where we can have patients die. And I remember being at one of our trainings where we were talking about melanoma, and the instructor said, okay, look around you. There were about 5,000 of us in this conference, and said 1 out of 55 of you will die or not die, but will suffer melanoma, which again is our biggest worry. So
Sure.
That's why I think it's really great that I do have the opportunity to chat with you about skin cancer and the different kinds that are out there. The most common is the basal cell skin cancer.
Okay.
The nice thing about it is if we diagnose it relatively early, or that it is definitely easy to cure. I think the cure rate on it is in the 90%.
Okay.
And so that really makes you feel a little better about that 1 in 5 if you are lucky to get that. I've always told my patients, I would love to stand in a cold line with rain and have not a hat or coat in order to get a basal cell if I knew I was going to get cancer. So, it's while it's not, it needs to be treated, it's not near as serious. The squamous cell can be, and that's the second most common skin cancer. And the reason for it is it tends to invade into the second layer of the skin a little bit more freely, and it can extend from there. And so, that makes it much more serious. The last, again, is melanoma. And I think one of the biggest concerns that really is kind of hitting us between the eyes is the fact that that is now the #1 cancer for girls between the age of 16 and 29. And that's an age group we shouldn't be having to diagnose this. And when you think about being 16 and being diagnosed with a cancer, even if you are successfully treated, you have that cancer label the whole rest of your life. So when you're trying to get health insurance, you're trying to get life insurance,
Right.
all of those things will have a factor.
And so that particular age group at risk because of?
Well, of course, we really feel like there is still the sun addiction that we have, and we haven't learned to be particularly protective, which is really interesting that, when you think about how wonderful we are here in the United States, and then you look at other countries, they're smarter on this point than we are.
Is that right?
Well, when you think about having a siesta, so you're getting out of the sun in the middle of the day, I love that idea. And, I see a lot of people who are Asian, especially even here in Lincoln, who have umbrellas, or they'll have hats that are protective. And I remember too, I grew up in the western part of the state, and we had migrant beet workers, and they had not only large straw hats, but they were all wearing long sleeve shirts. Even my grandma did that. So how, we kind of slipped away.
And, I think we talked about the fact that a long time ago, and many centuries ago, that people who were pale were sort of considered to be ill, or people thought they might be sickly. So the idea of having a little color to the skin meant healthy. And now what we need to do is change that mentality that coloring your skin, or by sun tanning and tanning beds particularly, is really exactly the opposite for us. And don't you think that in that particular age group that you were mentioning, the tanning bed is a phenomenon that maybe it crops up at that period in their lives?
To the point where the World Congress came out with a ban. I mean, they're labeling it as a class 1 carcinogen, right up there with tobacco.
Is that right?
What you'll find now is we finally, in the United States, have at least 18 states that have required a parent's permission for people under the age of 18. So it's going to be kind of like buying cigarettes from that point of view. Nebraska hasn't addressed it yet.
Well, hopefully we're moving in that direction. So how do we diagnose skin cancer?
Well, unfortunately, especially the basal cell, the more common one, can be real subtle because they oftentimes will look like moles, and they can hang around for 2 or 3 years because they aren't really fast growing, and so you don't know to ask anybody about it. But I would tell you that, if you're over 40 and you're growing a new mole, you maybe want to pay more attention to that. The hard part with that whole idea is the birthday fairy brings us spots.
I was going to say, there's a lot of spots showing up when you're after 40.
That's the problem for sure.
So is a good idea having like a yearly check or something like that, or charting your moles, or how does that work?
We try really hard to, as physicians, kind of group the effort where when you go in for your annual physical, I want to be sure that you nag your doctors to be sure that you take your clothes off so that you can have your skin examined, in addition to listening to your lungs and feeling for your liver, listening to your heart. We need people to look at the skin. What's amazing to me, because men have such a higher problem with melanomas, that one of the sources of diagnostic help is from the barbers.
Is that right?
Yeah, when you think about men without their hats, and hats aren't popular anymore, and we blame that on President Kennedy because he quit wearing hats. And so not even a fedora, so that was a little bit of a problem. Plus, men spend a lot of their time growing up without their shirts on when they're out working or they're at the pool.
Or in my husband's case, as a farmer, growing up on a farm.
Right.
Yeah.
And then as older the adults, the reason they keep pointing again to the statistics for men over women is the golfing.
Oh.
And when you think about men out on the golf course, if they wear a hat, it's just a ball cap. And the ball cap doesn't protect the side of your face. It's nice that it does protect the scalp, unless it has a lot of holes in it, which of course we like because then we don't think we're getting so hot.
Right.
What I point out is when we think historically, and you were pointing out that it was more fashionable to have a tan, that even before the time you're talking about, it was a sign that you were poor and you had to work out in the fields. And it was the elegant, we think about the Southern ladies with their beautiful hats. And, you go back to Gone with the Wind, always was pretty much covered up. Mm-hmm. And that was partly to preserve the skin. They knew back then, the more sun you get, the aging factor comes in. And if you wanted to be a beautiful belle, through your 60s and 70s, you got to protect that skin early.
So now, once the cancer is diagnosed, what kind of treatments are we looking at? What are the treatment options?
Well, the first thing we do is do a biopsy. And sometimes, unfortunately, people kind of assume that the biopsy, the first removal, is the treatment. But the biopsy is to confirm what you have, because sometimes it could be a nice old mole or a wart or a plain kind of fibrous scar, it could be something else. So the biopsy is critical, and then depending on what the pathologist sees will depend on what kind of treatment. With basal cell skin cancers, when I first got into dermatology, we would oftentimes just do what's called, we'd kind of cauterize them really vigorously with electricity, and then we'd scrape them, and we'd do that a series of 3 or 4 times. And since that time, I think we've gotten more into excising them for margins so that they can be checked to be sure that they're all clear. And there's a specialized treatment that's probably the most effective in terms of complete removal, and that's called the Mohs technique.
I had read about that.
It's named after Dr. Mohs, who I'm old enough, I got to meet him, and he
really?
was just a fascinating guy.
So explain a little bit what that is.
Well, what they do is it was different how it was handled in the pathology cutting of the tissue, so that the specimen can be looked at all around the margins and across the base, so that you know where there's any residual cancer, and you kind of think about like a clock, and to go back at 9 o'clock and get more, and based on how it looks under the microscope. And it's become an extra training in dermatology to be able to read our own slides, and also to be sure that the tissue's processed properly. But by being the surgeon and looking at your own slides, you really have much more connection about where on the patient you need to go and retrieve more.
And it's more expedient, I would guess, than sending it out and then bringing it back.
That's true, and it has a higher cure rate.
Oh, great.
So if you have even a basal cell that's a little bit more on the wicked side, you'd really like to have that technique done. Plus, if you have a basal cell even in a more common recurrent area, which tends to be more on the face and the neck, I think that's important. And again, like I said, if it was a little bit wilder looking under the microscope in the first place, you want to be darn sure that it's completely removed. Sure. And that's true with squamous cell too, because those, again, can sneak down a blood vessel, can sneak down a skin nerve, and that's, I think, where we have more problems with recurrence, is they metastasize. Sure. And you want to be sure you've got a nice, clean level before you say amen.
Yeah. Well, I noticed that you have some things here. Let's talk a little bit about what you brought us. I am assuming this is some suggestions you have on how to avoid getting skin cancer. Okay, what are we talking today?
Well, I'm pretty excited about this because I do a lot in my practice of trying to preach prevention.
Prevention, exactly.
Yeah, talk about, I hate it that I'm quoting all of the old time phrases, but the horse is out of the barn for a lot of us. And so when we come in to have cosmetic things, we're really trying to protect the skin at this point.
Right.
And the hard part is I don't think we got the message. Well, we certainly didn't when we were growing up.
Not all of us.
And now we're doing double trouble with the tanning booth. The problem with the tanning booth is the wavelength that's in it. And I think actually in some ways it's been valuable that we were forced to look at that wavelength, because for the longest time, we would say, okay, wear sunscreen, May through September, and then we started to realize, but September through April, we're actually getting more of the wavelength, the UVA wavelength that's used primarily in the tanning booth. And that's the one that can get you through window glass. So we oftentimes will see more aging effects and more skin cancers on the left side of the face because we're out there driving our cars. And, you know, there's a higher instance in occupationally for like airline pilots. Because they're up with the minimal ozone layer and have a lot of sun right
Wow.
on
And they
their
probably
skin.
don't think about putting sunscreen on when they go in the cockpit.
No, you know,
You wouldn't think of that.
we've been pretty excited for the farmers. At least now they have enclosed cabins.
That's true.
But you know, there's still a lot of light through that window
Right.
glass, so it could help in some ways and not in others.
So what are some preventative things here that we should know?
Well, we're talking about clothes, and I wore one of the sun protective shirts, and I brought several catalogs that we'll share with you about clothes that come with extra weave to the textile. Plus, it's interesting now, they're weaving in things like zinc oxide and
really? In the
titanium
clothing?
right into the clothing.
Wow, that's fantastic.
There is a laundry product called Sun Guard that you can wash with your favorite summer clothes, and it will put a chemical called Tinover or Tinosorb into the clothing and increase, like a white t-shirt they think has a UV protection level of 5, so you can take that shirt and make it at least to 20. The good news also is that one washing is good in terms of sun protection for about 20 more washings.
Washings, wow, that's fantastic.
It's made by Ritz Dye. Sometimes it's a little difficult to get your hands on it, however, so it may be not at your local grocery store.
Let's talk about sunscreens, because I know that there are lots of products out there. There's a whole lot of discussion about SPFs. What do you recommend?
Well, what we've hope is going to finally happen is finally the FDA got involved because we started focusing on the UVA wavelength, and that is not represented by the SPF number.
It is not.
That only talks about the burning rays, not the deeper damaging rays, which is what the UVAs are. And so now it's been deferred to December, but you will have a rating on there, and apparently they're going to try to do a diagram where they show you all of the radiation wavelengths, and then you'll have a little wave that will show you which each chemical will cover this far.
Okay.
You know, the hard part is, well, it's not so hard. Zinc oxide, and think back to those pictures of the lifeguards.
Yes.
You know, good old zinc oxide covers the whole thing.
Is that right?
You know, and so that's been probably one of the prime ingredients in the what are called physical blockers. And the neat thing about that is that they've learned to not make it so white.
Oh, I was going to say, because nobody wants to have the white patches on their face.
No.
So do a lot of the sunscreens have zinc oxide in them?
Yes.
Okay.
Yes, but the more popular ones are chemical blockers because they're a little bit more cosmetic initially. So we got into the habit of using a lot of, you know, copper tone and banana boat and some of those. And we kept hearing about Mexoryl, which is Mexoryl, Mexoryl, coming to us because it was the best chemical blocker for the most wavelengths. And it was coming and coming and coming from Europe, and you know, I would send people to Canada to get it if they needed that kind of sunscreen. Well, finally, the La Roche-Posay people, who are French,
Yes.
brought it to the United States, and it's pretty much through the L'Oreal line. And,
Okay.
But when they first introduced it, it was only at CVS, and for some reason they kept it kind of behind the cabinet, so you had to know about it. We have avobenzone, which was our kind of theory that this was going to be a good chemical blocker. What we didn't understand was it was only good for about an hour. And then it broke down.
Oh.
And we know we should reapply every 2 hours. And so that's
what we should do.
Yeah, we're talking about shoulds here.
Yes.
And so it actually was Neutrogena who came up with the knowledge that if you would put it with octocrylene, and I think, okay, think of 8 crying babies. I mean, how octocrylene needs to be in with your avobenzone to stabilize it. And I think what they called their product then is, they said it has helioplex in it. So you have to think crying babies and flying helicopters, you know, and so that'll help
or
you.
Or helium balloons.
There you are.
Lets you rise above the problem.
Right.
Now,
the problem was the stability.
When we talk about sunscreen, does the amount you put on make a difference?
Well, what they talk about is using, number one, you got to think about how much of your skin's going to be exposed, but they talk about it taking at least 2 ounces for the full, you know, cover the average body size, though I guess with the sizing up of the Americans, it may take a 2.5 ounces, 3.
There you go.
And you shouldn't be.
So if I'm going to put some on my face, are we talking dime size, quarter size?
Well, and again, I suppose technically that would depend on
the size of your
size
face.
of your
Right,
face.
exactly.
But you want to have a nice layer. And one of the things that I think is going to be also good about the new labeling is they're going to talk about sweat resistance. You know, they can't use the word sweat proof anymore or waterproof. They're going to have to talk about resistance, and they're also going to have to put a number on there. Like, is this good if you get, say, in a pool, it will be good for 40 minutes up to 80 minutes. And I'm starting to see that already on labels. So,
that's great.
Well, and especially because one of the other complaints is when I use that sunscreen on my forehead, it gets in my eyes and it burns. And yeah, I understand that. And so if you have a product that says, you know, sweat proof, and it's sweat proof or water resistant up to 80, I mean, that's pretty good number.
It should help you out.
Right.
Yeah, right. Now, I've noticed that lately on sunscreens, there is something called broad spectrum. They're saying broad spectrum. What does that mean?
That means both the UVA wavelength, which is the new one we've been focused on, and the UVB wavelength, which is the one that had been priorly addressed by the SPF number, are both in there. The hard part, again, is the stability and the whole width of coverage. So they can say that they have both UVA and UVB coverage, but we need that label that's going to show you the diagram. And again, with zinc oxide, it's probably our best across the board one. In makeup, we have more titanium dioxide, and it's almost as good.
Okay.
But, you know, we put on our makeup first thing in the morning. It's that reapplication.
Yeah.
And that's where this one company so far that I've found has come up with a powdered sunscreen that you can dust on. And it comes in a container with a brush. And I'm hoping that we will have a chance to demo that because then you can dust it on top. And for some of us who are silly enough to be running on Lincoln's half marathon.
There you go.
It was cloudy and rainy and miserable, and then ta-da, the sun came out, and we were out there. Now, I had put on my sunscreen, but I was able to carry this in my fanny pack and, you know, brush it on my face, back of my neck, on my hands. It's not something that I think you want to use for a total body because the darn stuff's expensive.
Right.
So we need some competition for that.
But that's a good thing
It's
to
handy.
know. It is.
You know, and I can get guys, I tell them, hey, when you get to that 9th hole, this you can take out of that ball bag and dust it on, and then you can be happy, hopefully, that you can get by with just wearing your little cap instead of a big one.
So in our last couple of minutes, what would you say is your advice? What would you like to leave with people? What's the most important thing for them to think about right now?
Well, I always hate this message because it means that we have to also take some responsibility ourselves to look at our own skin and pay attention. And I hope we will have a chance to add to this interview the warning signs of melanoma, because that's still our most serious one. But to me, if you see any changes, and this is a new category they've just added to the ABCDs, E is evolving or changing. So you got to pay attention. And I love it when I have patients who come in and will say, but my husband once, saw this, or, I know they show you the picture with the mirror and you're supposed to be looking at yourself. You need a full-length mirror. I mean, you've really got to be dedicated. And I think, though, you can look at your body, with exception of the back, pretty well. And the other thing that's frustrating is to look at the bottom of your feet. But when we talk about people of color, that's one of their main areas where they have malignant, we're talking about melanomas that oftentimes are diagnosed so late that they have a high mortality rate. So it's part of yoga. You gotta get that foot into your lap and look at the bottom of that foot and look between your toes.
And people of color are just as much at risk, and so we need to be aware of that too.
That's true. That's true.
Well, thank you so much for being here. This has been very, very helpful, very interesting. And I think you brought a couple of websites, maybe one website that we can reference that people could look at.
Definitely.
Okay, so the more that you get and the better information you have, the better all around. Thank you for joining us today. This has been Dr. Ann Lott talking about skin cancer. We hope that you've learned a lot, and if you would like more information, please reference the websites we've given you. And again, the women's health programs are hosted by the Mayor's Commission on Women. Thanks for joining us today.